Now, policy, believe it or not, is something that a lot of physicians and medical students can get, very invested in and involved in. All of you, by virtue of being here at CFMS, I presume you are student leaders in some form or another, and physicians by nature in the global health arena, at least when it comes to policy, often help to drive a lot of efforts and advocate. So the challenge with policy is obviously that it's not as grassroots, like you're obviously not seeing people or you're not helping to develop a clinical program. But the beauty of it is that you're actually affecting things at sort of like a 30,000-foot view. Now, that said, it will require obviously a unique skill set. Hopefully some of these sound familiar to all of you, people skills, soft skills, the art of the possible, so stuff like that, which also may require additional training. But that said, this is not necessarily an extremely unique skill set. It's one that obviously all of you, by being student leaders and by being here at this meeting, have. So policy is definitely another area that if you're interested in global health, and one that maybe isn't as well pursued by physicians, is something that you can look at as well. Then there's research. This is the old horse that's flogged to death a lot of the times when it comes to anyone who wants to do anything other than residency, right? And it's not just global health, it's like any research. It's basically all my suggestions and my talks and my ideas for staying involved in global health can also apply to staying involved in any kind of research that you imagine being involved with. I mean, I think we all know is that research is good for evaluating, improving, challenging, explaining things, but it comes, especially with global health research, comes with all the same negatives as conducting research in Canada, right? You got to do what I call grant begging, and you have to do, you have to deal with failed experiments, which are setbacks, but you pivot and you try something else, and you get little to no institution support often for research. Even myself, I've been a staff physician for a number of years now, and yeah, research is something that I'm still doing off the side of my desk. That said, there are a lot of positives. Once you get publications, you get to be known in the field, there's some recognition, you have opportunities to speak at conferences and network with people. And then the other part is that you can truly evaluate and cause impact in terms of the global health programs that you are challenging and investigating. So that said, if you get good at key papers published or you work with great people, research can be a very common way for you to stay involved in global health. Then there's teaching, right? So, I mean, as I mentioned, there's teaching kind of like abroad and at home. And at home, a lot of people, you can be involved with seminar series or with medical schools, teaching medical students or undergrad students. And then there's also teaching abroad. And this is where, remember when I talked about, if you're talking about sustained, ongoing, short-term efforts, one thing that's really good is helping to develop local capacity by teaching local healthcare providers or mentoring them. Because essentially, instead of you going down and providing the care, you develop their skills and their hospital and human resources by providing sort of teaching abroad and helping to develop local capacity. In both cases, this is perhaps more impactful and meaningful than just going down and handing out some pills over your vacation. So, but all that to say, we've done a bunch of stuff. I talked a bit about a bunch of opportunities. The question is, how do you locate opportunities, right? And so I have a few suggestions, and I mean, these are obviously not, these are just my own meandering experience and not necessarily anything novel. But honestly, as much as cliche it is to say, networking really is the most important thing. And from what I understand, a lot of people nowadays, or a lot of you are all on things like Twitter and LinkedIn and whatnot, which, I mean, I'm on LinkedIn, but I just usually log in just to accept people's connections. Like, that's pretty much all I do with it. So I have like all these connections, but I don't really know how else to make LinkedIn work for me. But networking is a great way to essentially locate opportunities. And what I mean is, you can do that in a number of ways. You can obviously go through friends and word of mouth. Going to conferences and putting yourself out there, meeting people, wandering around posters, going to presentations and talking to the presenters afterwards is a great opportunity. One rule of thumb I have whenever you attend a conference, if someone hands you a business card, always email it back within a week. It doesn't matter what they do. So the best part is, like, I was in Geneva at the World Medical Association's Junior Doctors Network meeting. And I meet this guy for like about 2 seconds. He literally comes up to me, he's just like, oh, hi, I'm a spinal surgeon from Germany. Hands me his card. We chat for like 2 seconds. He's like, I like Canada, he walks off. I'm like, okay. So I have this guy's card, and I emailed him a week later, because that's my policy, is always to email. If anyone hands me a card, I'll be like, hey, we talked, and you chatting, you mentioned you like Canada. And it turns out that he does a lot of work in antimicrobial resistance hospitals. And so now I've been talking back and forth with him for the last few months about possibly writing a paper together, comparing rates in Germany and Canada, comparing policies in hospitals in Germany and Canada, that kind of stuff. All from just a 2-second conversation. Now, if I looked in and was like, I'm a public health physician, this guy's a surgeon, what do I know? Like, not that connection might never have happened, but it turned out that he was actually really big into hospital-associated infections. So there you go. We're a conference and symposium. If someone hands you a business card, always make sure you email back. And then the other one that I found really successful is journal articles, right? So if you're reading away in your journal or you're reading newspapers and you're just like, oh, this is a really cool article. This is really well written. It's in English. It's great. Then you can actually take it. You can actually look for the author's correspondence and basically send them an email and say, hey, I loved your article. I'm really interested in this field. I'd love to work together if we can. The least effective one actually I found is responding to ads on websites. So a lot of foundations and nonprofits will post stuff, but a lot of the times they usually already have someone in mind when they're doing that. So I've actually had the least success in terms of responding to ads or websites and straight up cold calls. It's really good to at least have some sort of connection with that person. Either you've read their publication, or you met them and chatted with them at a conference, or you have a common friend. Those are obviously great strategies for staying involved in global health world. And all of you are all obviously a global health community, so I'm sure you all have different networks that you bring to the table to this specific network here as well. So those are, I mean, that's all stuff that's expected, I guess. But I wanted to get on with the rest of it, and these are just obviously where some opportunities spring up. I've talked a bit about them, obviously, but they're all the traditional ones, and for the purposes of time, I'm going to move on. So then the other question about the other things. Remember I had like a bunch of no's at the beginning, so it was like no awareness of opportunities. Well, we've covered off the opportunities a bit. We talked about time, right? So any of you played Cards Against Humanity? So this was one of my favorite cards in Cards Against Humanity, which was getting married, having a few kids, buying some stuff, retiring to Florida, and dying, right? As much as I've said this already, residency is demanding, but at the same time, you have a lot, I mean, this is generalization, I realize, but in residency, you also have less responsibility. Most of you don't have kids. You're not staff yet. And then you have no pre-existing relationships, really. You are unencumbered. You are a resident, right? And so essentially, you can make lemons from lemonade, and as much as freedom, you have a lot of opportunity, as I mentioned, to experiment, to try different things, to pivot if things go wrong. So as much as it's demanding, you actually have lemons from lemonade. Then the other part is money, right? And my wife actually looked at this slide and she's just like, that is terrible, terrible advice. I was just like, no. I was like, really, money can be earned and time can't be. And then the question that you should ask yourself is sometimes, is it worth it to go a little bit into debt to pursue opportunities? Now my wife has always been a bit of a, tight with the purse string. She's like, if you can't afford it, you can't go. But at the same time, sometimes you have your line of credit, and if there's a really great conference and a good opportunity for you to continue building or solidifying a relationship with a mentor or with someone that you've been publishing, or the chance to go present, maybe it is worth it to just take that trip and bite the bullet, knowing that you'll eventually earn it back in the future. Now, you do that too often, then of course you have financial management issues, but that's different. You can also do things like apply for awards and fundraise, and use those opportunities. The big thing is you should use those opportunities to become stepping stone. If you're just spending money willfully for the sake of enjoying yourself, that's one thing. But if you're spending money to essentially go and present a paper, or to go and network or collaborate, that's, even if you don't have money, sometimes it's worth it to use your liability if you have to. Eventually you'll get somewhere. And remember, as I mentioned, you can always earn money, but time is something that you won't always have. Then there's always the support or mentors question. So remember, I was like, oh, you might not have supports, you might not have mentors. This obviously again shows the value of networking and word of mouth. And as I mentioned, the big thing, publication of interest, chat with the author. The other thing is that a lot of the times we try to go for the biggest people in the field. You try to go, I'm just like, oh wow, Paul Farmer, pull a Paul Farmer. If I could do a Paul Farmer, I would, But maybe there's other immediate mentors in your residency program, in your university program, that you can just reach out and have a chat with, right? And then the other thing is that you never underestimate the power of close friends or friends with common interests. So for example, the 53rd Week, the nonprofit that I work with, was essentially just a really close friend of mine from IFMSA. He was from the US contingent, and he lives in Philadelphia, and I was from the Canadian contingent, and we said, well, a lot of these Canadian US Met students tend to go on short-term trips nowadays. Everyone goes on short-term trips, and they have questionable benefits for the community. Is this something that we can work on? And that's essentially how our organization got started. I think the big thing that you want to remember though is that if you commit to something, you got to keep your word, right? And you never, ever, ever want to burn bridges. Global health, and especially medicine, and we all know this, in Canada, medicine's an incredibly small community. Burning bridges is not a good idea. So, in terms of the skills thing, right? Then I have this old joke that an MPH is like a de facto passport into a global health career, and so I know a lot of you, especially if you're interested in a career in global health, have probably thought of doing a Master of Public Health at some point or another. As you know, obviously, the pros are that it's a great network. I did my Master's of Public Health at a small institution in Baltimore, and it provided me really great access to a network, and an institution provided me with additional courses and skills, which sort of helped with some of the teaching and research bits that I was doing. But the cons of an MPH, as I mentioned, it was pricey. It obviously took a year of my time. Sometimes you get support from your residency programs, but other residency programs may be like, well, why do you want to do an MPH? Why don't you do, I mean, if you're in Durham, it'd be like, I don't know, do an MBA or something. I don't know. But if you do decide to go and do an MPH, it really does matter where you decide to go as well, right? You don't just get an MPH from any school, and if you have the option to do it on-site versus in distance, I always recommend on-site because you make those connections, you meet those people, you forge those friendships a lot more easily than if you're at a distance. Now, if you're not going to do an MPH, there's plenty of other things that you can do, right? There's diploma courses, there's seminar series, formal mentorship and training, and then there's short courses. Then of course there's trial and error, right? It's just like, you go ahead and you try something out. If you're going to do that, same as with going abroad on clinical stuff, make sure you try to minimize the harms for the population that you're trying to serve and help. Now the final part, as I mentioned, is the institution backing, or you have no institutional backing or no reputable backing from it. An important thing, whatever you do, with whatever place you end up doing residency, is to show value to your institution of what you're doing. So always submit reports, always show them the papers that you're publishing, always give, when I talk about reports, like maybe when you go back, just submit a report to your school, or to, in residency, you'd submit a report and say, I attended this meeting in Vancouver and this is what we talked about. That way you show value to the institution by what you're doing, which makes it easier for later on to be like, hey, remember when you sent me to Vancouver last time and I managed to do X, Y, and Z? Well, it turns out that, I have another meeting to go to and I could do the same thing again for you. And they know that there are institutions out there that you're like, hey, I graduated from med school at the University of Western Ontario, which I did. And then Western will be like, okay, that's great. Maybe you should go and keep pumping things, etc., right? And then obviously all of this, internal grants, talking to admins, deans, and directors will all sort of fall into line, but it's all part of showing value to your institution.